All right, we've officially started the recording.
Very nice. Great. Well, then let's call the meeting to order as we officially have a quorum now. For everybody who didn't get the memo, Chair Oldsfry will not be able to make it tonight, so I will be stepping in as vice chair to chair the meeting. Shall we move forward now to the suspension of the rules to meet so we can meet electronically?
I move suspension of the rules to meet virtually.
Can I get a second?
I second.
All right. I think we need a roll call then, right, Jess?
Yes, we do. So Chair Ohanian.
Aye.
Right, Sherry Lackey.
Aye.
Thank you. Demita Criggins.
Aye.
Okay. Councilmember Burns.
Aye.
Thank you. Amanda Ngulla.
Aye.
Archana Sood. Sorry.
Aye.
Thank you. And Councilmember Burns. Councilmember Reed.
Aye.
Thank you. Thanks.
The ayes have it. Let's move forward now to the public comment. At this time, if there's anybody who'd be interested in either putting a message in the chat as a public comment or joining the panel to speak to the group, please raise your hand and indicate so. Do we have anything in the chat? I don't see anything there.
No chat and no raised hands.
Okay. Okay. Would it be okay if toward the end we offer that up again, or is that okay, Sarah and Jessica, just in case anybody wants to say something?
Yeah.
Great. Well, let's move forward then to item number 4 on the agenda, which is the approval of the meeting minutes for December 9th, 2021. If ever, can I get a motion to approve the minutes?
I move approval of the minutes from our last meeting.
Can I get a second?
I second.
All right, let's do our roll call.
Thank you. Chair Ohanian.
Aye.
Great. Sherry Lackey.
Aye.
Demita Criggins.
Aye.
Okay. Amanda Ngulla.
Aye.
Archana Sood.
Aye.
Councilmember Burns. Councilmember Reed.
Aye.
And Councilmember Burns.
Councilmember Burns, are you still available?
Councilmember Burns responded aye, and I'm just wondering, did we lose Jessica?
Oh, I'm still here.
Oh, Jessica,
Oh, okay.
you're still here.
Clearly, the city is having some internet issues. We apologize in advance. Okay, great. Minutes passed. Thank you.
Wonderful. All right, let's move to item number 5, which is the staff report, Zoom grants reporting working group update.
I am
Who owns
going
that
to
update?
start off with one thing that is a frustration to us all. We're over 1/4 of the way through the fiscal year 2022, the federal fiscal year 2022. And of course, they have not yet approved their appropriations bills or passed a federal budget for the fiscal year 22, which leaves us waiting to find out what our CBG allocation will be still. Just so the continuing resolution that the government is operating under right now expires on the 18th of this month. Some people are expecting that it's more likely that they will pass a full year continuing resolution. So we will be basically getting very close to likely very close to what we got. There's always some change in the formula every year. So I don't think it will dramatically affect our estimates of our budget, but I just wanted to make people aware of it, that our budget will still be lower if it is that than it was in 2021, because in 2021 we had that additional reallocation of 2020 CDBG to CARES Act uses that gave us a little over 124,000 more than we normally would have. And that CARES Act reallocation to provide the ability to use more for public services only applied to the 2019 and 2020 CDBG funds. So it doesn't apply to any unexpended 2021 CDBG funds. We can't do that again. So I just wanted to make you aware of that. Then Jessica's got some other additional staff report stuff.
Okay, thank you. So all agencies have submitted reports with the exception of the Housing Authority of Cook County and the HAC, due to the late release of funds, is going to begin their case management program, which was a partnership to provide case management services to residents of the HAC-owned buildings, Perlman and Walchurch. So that program really hasn't had the chance to get off the ground until 2022. So they will be reporting in the first quarter of 2022. But all reports are in for all other agencies. And I have to say they look great. Agencies really worked hard in an incredibly short period of time and a trying period of time to provide a wealth of information, not only around the number of participants they served, but also around those extra metrics that we asked about service plans for case management agencies and the number of times those service plans are updated and referrals. And then for safety net agencies, again, a lot of information about additional referrals and who was able to access additional supports, whether it was within the agency or externally. So I will have sort of a spreadsheet of report information that the committee can review at the March meeting. But really kudos to all of the agencies. It was a lot of hard work and we appreciate it. We also, there's been talk of ARPA funds and the city is in conversation with the Evanston Early Childhood Council to explore ways that ARPA funds can be used to sort of help our early child care providers. And the reason that I'm mentioning it in this meeting is because those decisions might come through the Social Services Committee. Some of the social service projects that have been discussed at the council level have a programmatic component, but then they also have are bricks and sticks, like a capital improvements or a capital facilities project component. And that would most likely go through the Housing and Community Development Committee. And so we're exploring ways to present good information to this committee and to HCDC, possibly through some joint meetings, which many of you are familiar with. So we also have good news around ESFCV. So ESG, I'm not sure if the committee allocated the Emergency Solutions Grant for 2021 at one of the earlier meetings. I think it was the first meeting that the Social Services Committee held back in September, October of 2021. So the city is on track to reach its expenditure deadlines for ESFCV. The city partnered with Connections for the Homeless, and the bulk of our ESFCV funding went toward rapid rehousing, a little bit toward prevention, and then funding for case management. There was also money for HMIS, the Homeless Management Information System, which is managed by the Alliance to End Homelessness in suburban Cook County, which is the city's continuum of care. But unlike a lot of municipalities across the country, the city is on track to spend down this money, and it's all due to the hard work of Connections for the Homeless, our partnering agency and their case managers. The feds are considering providing an extension on those funds. So that just lets us all know that the challenges that other municipalities had in spending ESFCV. The original deadline was the end of March, and the extension is through September of this year, but we hope, we don't think we're gonna have to take that. So.
March is the 80% expenditure
80%.
deadline. So it's a little more time than that, but some of you may not really be familiar with ESFCV. That was one of the CARES Act funding things. Normally, just to give you perspective, normally we get about $150,000 in ESG every year, our normal ESG grant. Our ESFCV was $966,314. I have some of these numbers really ground into my head. I've seen them so many times. So it was a huge additional amount of funding. And the primary purpose was to, because of the impact of COVID on increasing the homeless population, it was, all of this was released to address the threat of COVID. And most of it, as Jessica said, was used for rapid rehousing, which is really a rent subsidy to put people into their own housing, into apartments. And so in a number of cases, individual households are getting up to 2 years of rent subsidy while they get back on their feet. But it was a pretty major part of the early response to COVID-19.
Thank you. I do tend to get a little nervous in meetings and ramble on, so I appreciate Sarah kind of bringing me back. So, but I think that's all we have for staff report. Am I correct?
Thank you, Jessica. Thank you, Sarah. Do any members of the committee have any questions or comments based on the staff report at this time? Okay. We can move on then to item number 6, which is support services. Sounds like Sarah and Jessica, there's you're seeking some direction for the allocation of this $200,000 for support services. Is that correct? Item A.
I apologize, Councilmember Burns
Has a question.
Yeah.
Oh, Councilmember Burns, yes.
Sorry, Chair, I put my hand up late. So sorry. No, so this is only a comment because childcare was mentioned. So, we, Councilmember Reed and I have talked a lot about the idea of supporting family members who are providing childcare for other family members to be eligible to receive ARPA funding of some sort to support. So basically broadening how we view, child care providers, and obviously there's other things that go into that. So where somebody, for someone to qualify to be a official private works child care provider, but that is something that I would love to learn more about. If we could, I'm not sure what's the agency again that's working on that, on bringing back some recommendations for ARPA funding. I can't recall. I know I've met with them, but I can't remember.
It's the Evanston Early Childhood Council. So there are, I think, 26 childcare providers in that. And I would be very happy to talk with both of you about this idea, because it's something that one of the things is there are a lot of needs and services that aren't necessarily completely covered by just that council and the members of it, although they do an amazing amount of work. But so maybe three of us, I know Jessica could set up time to talk.
Yeah, that's all. I just, since we mentioned childcare, I just want to throw that in there because
Yeah.
I didn't talk more about it, but that's all.
Thank you.
Thank you, Councilmember Burns. Councilmember Reed, I saw you had your
Yeah.
hand up too.
Well, obviously I'll second that. But I also would like to see Jessica or Sarah a breakdown of the ESG the CESG funds, the CV ESG funds that were spent for the pandemic. If there's an itemized, somewhat itemized list of the expenditures, that'd be really helpful.
We are in the process of putting together the, absolutely, we can get that to you. That is one of the things that will be in the consolidated annual performance and evaluation report that we're working on for HUD. That's part of our, every year we do these reports, and the CARES Act funding will be included in that. I'm sure we can get you something simpler because you don't necessarily need that huge document, but absolutely we can get you information on that.
Thank you. Thank you.
Thank you, Councilmember Reed. Actually, Sarah, that's an interesting, I'd be interested in seeing that document too. Is that something that you could share with the broader committee as well? Or is it something that potentially we can quickly review at the next social services
Absolutely,
committee?
we can send it out to the full committee.
Wonderful, thank you so much. All right. So that was we circled back quickly to item number 5 for the staff report. So I think if there are no other comments at this time on that, we can now move forward to item 6, which is support services. Sarah, Jessica, I'll let you take it away with item number A.
Sorry, I was clicking around to see if I had that chart actually handy to pop up on my screen, but I will refocus. We can absolutely provide that to the committee. And I do have a slide, if I could. Oh, I apologize. Yep. Give me just one moment. Everyone see my screen?
Yep, I can see it.
Great. Okay. So this is just a brief overview of the working group that was established in December. The working group was composed of Council Member Burns and Chair Oldsfry. They met briefly in December to review the report structure for case management and safety net services. And then they met with agencies in January. So they met with the case management agencies January 5th and the safety net agencies January 7th to hear any concerns, thoughts, challenges with the new report structure. And since, even though we did not have quorum, that meeting was recorded and the work of the working group was discussed. So I'm not going to dwell too much on this, although if Councilmember Burns wanted to share anything or if committee members had questions, I'm sure we could take a minute to see. If not, I'm happy to move on.
Anybody have any questions or follow-ups? I have a quick one, but I'll wait to see if anybody else has anything. No? Okay. Jessica, thank you for putting the slide up. It helped kind of jog my memory here. Was this, I know last time we didn't have an official meeting, and I don't remember if the meeting minutes were tracked, but in January, but was this the one where we were discussing kind of the data elements, and we were talking about adding like the education layer, asking about education layer for those seeking support services, and I think there were a couple other follow-ups. Is this what that's related to?
Yes. Yeah, so I'm happy to go over the report components as they stand now. I'm sorry, I did not make any changes to the reports based on any discussion that happened in January. I
Right.
apologize, but we can revisit that.
Yeah, could we? And then I don't know if if we have the whole, since we have a quorum with the committee, maybe that's something we can quickly review again. And for anybody who was not on last time. Any other suggestions we can add to that? Reviewing the data set.
Sure. So for case management, those report components include numbers served, service plans created, updates to those service plans, the number of contacts that case managers had with participants. And again, that was a rough estimate for some agencies. It was not necessarily specific down to the number. Referrals and the referral partners, outcomes, successful, and then, voluntary exits to programs. And for safety net services, the report components included the number served, the number of service hours, and types of services, any referral types, whether those were internal to deeper services within the agency or external referrals to partners, and information about those partners, information about, and again, successful and voluntary exits of services. So, and I'm happy if committee members had questions. I do have sort of a brief overview of agencies and the numbers they've reported. It's kind of a lot of information, which is why after review, Sarah and I thought it would be better to present this information in more depth in March. But agencies really, really did a great job and came through with pretty consistent numbers and data.
It's good to hear. Yeah, that would be great to see that in March. Kind of a summary overview of all that. So that'd be really good.
Sure. Were there, and I apologize for not having this off the top of my head, if there were components that committee members wanted to add to reporting around education gains or anything else, I'm happy to start taking notes and chatting it up with agencies about that moving forward.
Yeah, I thought that would be an interesting component to capture, just to see if there are any impacts or any trends that can be spotted that way. I thought there was one other one that somebody else recommended last time. It's escaping me right now, but yeah, we did talk about education. There was one other thing.
And Chair, I may have missed this out for a second, and I know you had some good demographic additions that we wanted to capture moving forward. Did we get those in there?
Yes, we did. So the demographics that we captured, I'm sorry, I'm looking for those notes. That was, I believe, about successful completions of service plans and then voluntary exits.
Yeah, just I think it was that. Now I remember we wanted to also see if we could capture if somebody exits a program or an agency and then goes to another agency, trying to see if there's that transfer of services and potentially to start to understand why that would happen or why that would be the case. I think that was the other data element that we were thinking about.
Possibly something around income too, if I'm remembering correctly. So Derek, I think that came
around income.
Didn't you bring that up?
We do have to capture income information. Okay. That's one of the requirements. And I just wanted to ask for clarity because on levels of education.
That's what it was. Yeah, it was levels of education.
And I think that is something that we can certainly get in case management. I don't know how easy it would be to get in all safety net programs. I think that's something that we can certainly look at, but levels of education obviously could be useful to us to see who's being most impacted and stuff like that. And I think that that's something probably we should discuss with the agencies and try to figure out where, when and how to capture that, because it's not as easy as some of the other ones to do, or it's an extra thing, shall we say. So, but I've made a note of that. And the shifts between primary service agencies for case management was the other one we were talking about. Yeah.
That was it. And is the education around the different terms and can you explain a little bit about the education piece? I know we talked about that on the committee.
My impression was that the idea was to capture people's levels of education so we can see the impact on, as a demographic thing. Obviously, one of the things that we frequently, I'll use the case management in our TBRA programs, for example, where they.
Yeah, I didn't mean that because I don't want you to have to go off. I mean, and I found it in my notes. It was reviewing and clarifying definitions. That's what it was.
Okay.
Oh, yeah.
Did we get that? We'll set up a time to do that. And that's probably something that's worth doing on an annual basis, but certainly just finding a way to work that in. I know that was something else that came up.
Yeah, that is something that I think staff is hoping to bring back to the committee when reviewing the report structure.
Okay.
The report structure, it was our hope to keep this report structure, and we can add things potentially. I need to work with Zoom grants. I think to a certain point, once we start making changes to the Zoom grants reports, there are challenges with the information that's already been entered, but we can ask agencies to include like separate narratives. So there are workarounds, but staff was hoping to keep this report structure through 2022 and then look at revisiting and changing the report structure for 2023, because it's in 2023 that we will be opening up a new application cycle.
Yep, that makes sense.
Does the committee have any other recommendations potentially or thoughts around? Now it sounds like for data components that we can capture in the 2023 cycle. Does it, if any other thoughts at this time? If not, I'm sure we'll, when we have the discussion in March, sounds like Jessica and Sarah about the overview, we potentially some other thoughts or ideas may come up at that time.
Yes. Staff has always given the reviewing committee the opportunity to look at the application and the report structure. This committee has not had as much time to do that given our condensed cycle, but this committee will definitely have the opportunity to do that moving forward. And I'm so sorry, it was just our condensed cycle. But that was the goal of the working group, to take one more look. The report structures for case management and safety net were reviewed by the mental health board prior to that board's dissolving and social services reforming.
You're anxious for a year that is more normal in terms of how we handle our process, simply
Right.
because it was a little chaotic this time, let's face it.
Okay. So I'm sorry, Jessica, are we for part A? Is there anything else we need to consider for part A there, the funding recommendations? Or
For support services?
Mhm.
Okay, so there are two components in this one memo, and the first is forming a working group And again, it would be 2 members of the committee, ideally people who would volunteer, to generate ideas for procuring mental health services. We've heard from agencies, and not just our case management agencies, but sort of all of the agencies, that mental health services were a need. The committee expressed interest in focusing the support services funds on mental health, and perhaps specifically medication management and psychiatric services, although that has not been defined. And that's why we would want to form a working group to see how we can best think about procuring these services, or creating space for Evanston residents in case management programs. The other goal of the working group, or the other goal of the committee tonight, is to review the applications that didn't quite fall under case management or safety net services. So this would be the applications for Trilogy, Northwest CASA, Shore Community, and Youth Job Center. And the committee can either discuss how we want to move forward with these applicants, or the committee could ask the working group to consider that. And finally, under those sort of additional applicants, we have Impact Behavioral Health Partners. Impact did not complete an application because they knew at the beginning of the change in our process that they didn't, they had other sources of funding for their case management services, and they did not believe that they fit under case management or safety net, but felt that they would be best under support services. And because they've been working with the city, we didn't want to not bring them before the committee without some discussion, because, you know, as I've said, they do provide services, and they do believe that they're a good partner. It's just they did not believe that their services fit under safety net or case management.
And Jessica, the working group, that first bullet, that would consider both the questions, right? The classifications for some of these agencies, as well as the additional generating ideas for procuring mental health services, additional partnerships, right? That working group can focus on both of those.
The working group could, or the committee could discuss those additional applicants, the second bullet point, tonight as a full group.
Okay. See, Councilmember Burns has his hand raised.
Is it limited to 2 committee members because of OMA, or?
Yes.
Yeah. Well, as always, I'm happy to volunteer my time. This is obviously an important issue to the 5th Ward, so I'm always available for these type of discussions.
I'm also happy to volunteer for that.
So am I.
Sounds like we've got it. Jessica said needs to be a maximum of 2 for the working group because of OMA requirements. So Councilmember Burns, Councilmember Reed. I'm sorry.
Could we just schedule a special meeting and discuss it? That was my concern with about 2. 2 is just so few people, and I would like whoever wants to participate in that discussion should be able to. So I don't know if we want to make it a part of a regular discussion, or a discussion in one of our regular meetings, or if we want to hold a special committee meeting.
Councilmember Burns, I think that this is an important topic. We have 3 committee members interested. I think that we should make that work to have a working group that has 3, and we have flexibility in time. I mean, we have to notice it and everything like that, but it doesn't have to be a night meeting. It could be a day meeting. I think that it's an important topic, and we've got interested committee members, and I really don't want to start out telling anyone, well, we got to boot somebody. I mean, we don't want to have millions of subcommittees that are 3, so we have our, entire life taken up with Open Meetings Act, but I don't think that we want to either just say we can't do it. We're not trying to be that adamant. So I think
Yeah,
we will work out a working group subcommittee almost because it is with the 3 of you, if everybody else agrees that that makes sense.
Yeah, unless someone else was interested, but it sounds like we have 3 volunteers.
And if
Interested,
we-
but there's already 3. So I'm like,
but now the other thing is we've already gone past open meetings.
That's what I was
So,
gonna
I
say.
mean, we're doing open meetings. So honestly, I think that if you're
Join us.
interested in, I mean, honestly, I think it may be more effective sometimes to have a smaller group because you can really get discussions, but we've got a lot of practitioners who are have a great deal of knowledge, and I would hate to not take advantage of that knowledge in this situation. So we can add you.
Yes, we're up to 4 right now, so I don't know if there's anybody else. If not, I think we have a committee.
Well, and nothing
Do we need to
precludes
vote
us.
on this? Yeah. Sorry, Jess, go ahead.
I'm sorry, I should have raised my hand. Nothing precludes us from discussing some of these things now.
Correct. So if you want to have a discussion of it at the committee level and then ask the working group to continue and come back with a recommendation, that I think that it just seems like a lot to try. We don't necessarily have all the information we might need.
It's a lot to discuss. I feel like it's something we should, we need some time, dedicated time to only discussing that,
Right.
which is beneficial, those breakout groups.
Well, do we need to do a roll call vote to form this committee or to set a time for a special meeting, or is that something like that?
We don't have to do it at this time, I don't believe. I think that it might have to be, it is like a subcommittee. I think that maybe it would be appropriate to have it.
Yeah, we can
approved.
vote to form the subcommittee.
Right.
But we don't have to vote to set the meeting of
A
that
time,
subcommittee.
yeah.
Yeah.
And that we can follow up with the working group members separately and then publish it, obviously, and post it as we need to. So.
Wonderful. So can I
I move
get a
that
motion?
we
then?
I move that we create a subcommittee or a subcommittee / working group to focus on the item at hand.
Can I get a second?
Second.
Okay.
All right. Do a roll call.
To the roll call vote. I apologize, I can't see anyone, so can I stop sharing my screen momentarily? Thank you. All right, Chair Ohanian.
Aye.
Okay, Sheree Lackey. Amanda Nagola.
Aye.
Archana Sood.
Aye.
Thank you. Demita Cravens.
Aye.
Councilmember Burns.
Aye.
And Councilmember Reed.
Aye.
Great, thank you.
Wonderful. So then, just so I'm clear, then for the new subcommittee that was created, you will take on the procurement of additional mental health services, as well as the item number 2, which was the additional applicant classifications. Is that correct? Just wanted to make sure.
That can be up to whether or not the committee wishes to discuss that tonight, or whether they wish to have it go to the subcommittee. And it doesn't have to be decided. If there's any discussion that you want to have that could inform the subcommittee, or just bring thoughts out, that's entirely, I think, up to your prerogative how you want to handle
Is this the last agenda item?
It's number 7, yeah.
This is the last. Okay. Have a little chat about it. Anybody had any? I couldn't hear who's on the committee. Who's the finalist though? Before we get into that, Sarah or Jessica, who's a part of the new subcommittee?
So I have to say, I was having trouble seeing also because I was sharing my screen. I couldn't see any of you. I think that Councilmember Reed and Councilmember Burns requested, and then I believe Cherie Lackey also requested.
And
And
Amanda,
Amanda Angola.
Oh,
and
perfect.
Amanda.
Okay, thanks.
Okay. And I think Demita also may be interested, so we can add her,
Yes.
unless I'm getting
Great.
that wrong. Perfect. Thank you.
Great. So now we have 1, 2, 3, 4, 5. Okay. We have a quorum.
Yeah.
That's all right. I mean, I really do think this is an important topic, and I really think the
Yeah.
knowledge that all of you who are actually in the field can bring can provide can inform decisions that we wouldn't have without that. So, all right. So Jessica and I will follow up with the subcommittee members to figure out a time for a meeting, and then we will let the whole committee know, and also then do whatever publishing and notifications of the special meeting. Because in essence, I don't know, is it, Councilmember Reed, I'm going to have to appeal to your much better knowledge of Robert's Rule, because it is actually a quorum. I mean, it's what would be a quorum. Is that something that we have to do anything differently with?
No, that's perfectly fine.
Okay, just checking, because I know you
No,
know
thank you.
Robert's Rules of Orders and the city's rules much better than I. Thank you.
All right. Well, then, yeah, with some of the time that we have left, we should discuss the applicant classifications that Jess had on her last slide, the second bullet. Jessica, who were or do you want to share the screen, or do you want the names again of the agencies that we were talking about?
Yes, let me share my screen. And thank you. Okay. So, yep, here are our current applicants under case management and safety net. And so this is an opportunity. All agencies were invited and knew that this was going to be an agenda item. And the reason it's an agenda item is because agencies might want to change, but also committee members might feel that agencies were misclassified. And so this is our chance to bless this or change it as all see fit.
Jessica, do you have any recommendations off the?
Thank you so much for asking. I have to say, for the two applicants who did switch from case management to safety net, those two applicants were Books and Breakfast and North Shore Senior Center. It was challenging. They had to create whole new applications in the new heading so that they would be able to report in the new heading. And I would not want to recommend moving anyone and causing that administrative burden. I think we can get the information we're hoping to capture, at least in this first year, from agencies as they stand. But if agencies feel strongly about wanting to switch, staff wanted to provide that opportunity.
So it could be an opportunity to invite any of the agency representatives who are present, if they want to speak to this, for their agency to raise their hand, and we could hear from them.
Yeah, you read my mind, Sarah. I was thinking the same thing. I didn't know if there were any desires, if any of our organization agencies had desires to be reclassified or classified differently.
It looks like Kim Lutz has her hand raised in the attendee chat. Can we add her to the panel, Jessica?
Yep, let me work on that.
Absolutely.
So Kim is from North Shore Senior Center. Kim, can you hear us, or are you able to speak?
Can you hear me?
Yes.
Yep.
Okay, so we wanted to, first of all, thank Jessica for all of the hard work it has taken to help us fit into this new category. And although we do provide case management services to a great number of Evanston residents, we do also understand that the way that we're understanding case management might not be the same as the way the committee is. And that because of the nature of the people that we work with, once somebody becomes a client of North Shore Senior Center, they usually stay. So they continue to get the same services year over year and don't necessarily make progress on a service plan the way that the expectation is for the reporting of case management. I mean, to be honest, most of the people who leave North Shore Senior Center's service, it's because they die, or like most of them, that's the main reason. You know, some people move, but most people stay with us and they don't progress in their service plan in the way that they would need to. It would look like we were not being successful if we were to stay in case management. So I think that we are grateful for the chance to be able to explain what we do, even though we are providing case management. We appreciate that the way that our reporting wouldn't reflect the progress that you all would have expected. So we just wanted to say that. Thank you.
Thank you, Kim.
I'm curious. I'm a little still curious on that. You know, I don't know if there's if you need to have new clients in, different clients in annually in order to qualify as case management, but I would hope even our kind of senior members of our community could still kind of set goals and achieve them while they're in case management. So I don't know, Kim, if you could speak a little bit more on that, on what I'm missing.
So I think that we obviously, and to be frank, I am the grants manager. I am not the service provider. Like, I don't provide direct service myself. But we do make plans with our clients and we do assess their needs on kind of all aspects of life. So what are your spiritual needs? What are your nutrition needs? What are your self-care needs? What are, your health needs? And then work to connect those people with the resources either within our own agency or outside, depending on what their needs are, to make sure that they are safe and secure and having adequate nutrition and they're being able to live their fullest life based on the way that they identify that, where we follow a person-centered approach to our client service delivery. So each of the individuals is setting their goals, deciding what they think is most important. And so, yes, we also believe that the goals that they're setting for themselves, we want that's an important process. But I think that a lot of the needs that people are coming to us with are fairly basic, and they are kind of continuing. Yes, I'll get connected to benefits, but that needs to continually be maintained. Their financial situation is not going to improve, say, if that's one of their goals, to have, more security in their housing.
Right.
Once they get that, it's not going to improve beyond maintaining the benefits that we're helping them secure and that we're advocating for them for. Does that make sense?
It does, yeah. Although I feel in some areas, in particular in the areas of health, nutrition, exercise. I think there are some areas where, they could see some continued growth, but I better understand what you mean. So thank you for that.
Thank you for asking.
Are there other questions for Kim at this time? Okay. Well, thank you, Kim, for raising your hand and joining.
I don't see any other agency members who have their hands raised, so I'm taking that as everybody is staying in their current lane. One of the things that I think we may also find is as we get farther along, a lot has changed in the world of COVID, and as we get hopefully farther toward a recovery, and we may see changes in services that are the focus of things as we move into toward 2023. So one of our big challenges is really 2021 wasn't functioning under this full system because we just didn't get going early enough. So I agree with Jessica that in a way we want to not disrupt agencies any more than necessary, at this time, and knowing that we're going to potentially we'll look at that in the next cycle. So I think that could be beneficial if that's how they're all feeling too. So. And I don't think we need a formal vote on this because it's just making sure that everything's moving forward in the best format to get us the data and the results, both to help our residents and to get the ultimate information to help inform decisions in the future.
Well, I'm comfortable leaving things as they are right now, given that the level of discussion that's already occurred here in the committee and with the agencies having an opportunity to share if they disagree. So I'm comfortable with leaving it as is.
We do have a hand raised by Impact Behavioral Health.
Oh.
Hi, this is Lori Flanagan calling. I'm the Director of Development at Impact Behavioral Health Partners. I don't know that any of my colleagues are on the line, but it appears that Impact did not submit an application. As I understand it from what you said, Jessica, was because we were not sure that we fit within either of the parameters correctly. And I'm just wondering, would it be possible for us to submit something to this new ad hoc committee so that we could share the work that we do? And I'm just wondering if that would be a possibility.
Lori, I could address that. I think that the reason we have Impact listed here is, in spite of not having put in an application, is exactly because your organization had been in discussion all along about being a support service provider. In other words, we're recommending, from Jessica's and my standpoint, it would be to certainly consider you as one of the potential organizations that could be providing some of the support services that is that money that has not yet been allocated for 2020 of the 2021 money even.
Great. Thank you for clarifying that, Sarah.
And even in saying that, I think it would be helpful to get a proposal if we don't have one already, and whether, I don't know, Sarah, if that will go to the new subcommittee or back to the full committee, but I think that's
what I think we might want to do with that is have the subcommittee meet, talk about what we need, and decide how to format requests so that we get consistency and have something that we can look at. I really am not, I don't want agencies to start writing things without knowing what we may be then asking them for.
Yep, that makes sense. Thank you.
Yeah, whatever we come up with in that subcommittee in terms of the format and the questions, we can then definitely share in the March one as well. The March meeting, the full committee meeting.
Just as a reminder, and this was a long time ago when we were talking about the whole system, one of the things we talked about was working out a fee-for-service basis that would allow us to get people into services that are that financial capacity is keeping people out of getting. And we'd also talked about looking at ways to possibly fund, allow the use of individual practitioners, not only agencies, because one of the challenges we run into everywhere right now is I think that the capacity of all service providers providing mental health services is so strapped because the need is so high. And so we need to look both creatively at ways to get people access to services. And we'd also talked about the importance of looking at new ways to overcome barriers, like people who were having difficulty finding professionals in the field who they felt comfortable with and that they felt would understand them from their cultural lens and coming from their personal background, and that they would be comfortable going to. So I think all of those things would be part of that discussion.
And Chair, I don't know if Demita would mind speaking to that as someone who is in the field. Just is there a shortage? Right, we're hearing it certainly, but is there a shortage of mental health professionals, and if so, what do you think is kind of driving that, and also do you have any ideas on how we can what can improve it?
Yes, there's definitely a shortage. The private practice I work for, as well as most other people I know, are to full capacity. We have waiting lists. 2 years ago, we didn't have waiting lists. I still think it's an overflow from the initial pandemic, as well as the other things that were going on in the beginning of 2020, right before the pandemic as well, where people finally realized, hey, I do need to speak to someone professionally. And so now we have all these people rushing in for services and not enough providers. Insurance is also an issue too, whether or not the places that you go for care takes your insurance. If you are private pay, it depends on whether or not the agency wants to do a sliding scale. A lot of them don't. So, people can't afford $200 a session on their own. And giving them a break only goes down to about maybe $125. Again, unless you're with the agency who does a sliding scale, where they'd be like, okay, just give me 20 or whatever here, but that's not the norm.
Hey, Demita, has the average cost of services over the last couple of years, given that you're mentioning that there's a workforce shortage for providing the services, has the average cost gone up as well for patients?
No, it hasn't gone up. Actually, we did okay a year and a half ago because a lot of the insurance agencies, they decided to waive copays. So for a whole year, it wasn't up. It was up until maybe December, where everyone who came to see us since 20 didn't have to worry about paying their copay. But now the insurance agencies, they put that back on. And then now what's going on, the insurance companies are way behind in paying the providers for the services. We're still waiting on payment from December. So that could be a thing too. Sometimes providers may not want to take on too many new people. If we're having a problem of getting funding coming in from people we already have, so it's a lot of different issues. I think being able to help people with services really would have to come from the providers themselves, them being willing to, maybe do some things pro bono or discount yourself. I have 3 patients that I do pro bono because of their particular situation, but again, that's up to us. So.
Right. And everybody can do, not everybody would have the bandwidth or the time to be able to do that either.
Yeah.
So yeah, definitely.
Maybe if we, I don't know if there's a part in somewhere in the city where we can just have just an agency for the members of, for the residents of Evanston to come and get mental health services, like just a specific area, not, we have a bunch of different agencies that provide mental health, but what if the city just had their own just umbrella of mental health service and hired people for that?
Very interesting thought. We don't have anything like that, Sarah or Jessica. We don't have like as part of the health board, as part of the health commission, the city health department.
We do not have direct mental health practitioners, with the exception of our a number of our staff in the human services department are licensed social workers. In fact, many of them are, but we don't provide clinical mental health services. And I don't think the city is in a position to staff up and enlarge, at least not using this money. I think that would have to be a decision that would come in a budgeting and planning thing outside. The role of the Social Services Committee is to determine how best to use money that the city controls to help fill the needs of our residents for things that the city doesn't provide directly. And I don't think, that is something that could be talked about, but it's well outside my league to be able to determine if that would be a good way to approach it. I'm not saying it couldn't be. I just don't think that we can do that effectively with the funding we're talking about right now. I think that would be a much broader discussion and involve a totally different approach in budgeting and everything else that goes along with hiring additional staff or creating a new division or anything within the city.
Yeah, I think the health department, more specifically the youth and young adult development team, is hiring a new mental health or health practitioner, mental health practitioner. I think I need to check in on that. But Amita, I've had similar thoughts. In fact, one of the last times you spoke, you kind of presented to this committee in a sense about your work. I was taking notes, trying to think, okay, how many, if we hired someone, how many new cases, right, could that person sustain, as opposed to if we went out and worked with an agency, and both may work. My only concern with all of this is we spend money for someone to end up on a waiting list. That doesn't feel good to me. Like if we spend city money, I want to make sure that that person, when they need it, can go somewhere and get help that day or that week, or at least in 2 weeks after the request is made. And that's my number one concern, is not being able to control for that when we partner with outside agencies. And so with most everything, I lean towards having someone that is City of Evanston staff, or at least a direct contract where we know, okay, for this amount of money, we get this many hours or whatever it is. And I know it's complicated and those are much longer discussions, but I just want to say, to me, that I typically think in that same way, because there's a lot of waiting lists. You think the program has available capacity, and it sounds good on paper. And they're like, yeah, go to our website or call us when you need us. But then when you take one step closer towards it, you end up on a waiting list, and it's hard for you to get connected to the services. That's what I'm really trying to address. So I think it's something we can continue to discuss. even if it's with ARPA money, using ARPA funds to try to pilot some new approaches, I think is a possibility. So thank you for that.
Well, one of the things, Councilmember Burns, that the idea of having a, fee for service would be to get around that being at the wait list, because in many cases, people who don't have funding, have the ability to pay, are the ones who are on the wait lists. And there, it seems to me that there are even different wait lists. It's like based on your insurance or whether you have Medicaid or all those things. So the idea was to get people into services, at least with, in other words, they're coming with money on a fee for service basis to be able to get directly into services was the goal of, or was the idea behind this. So you're absolutely right. We don't want to have people sitting on a waiting list when we're trying to, the whole point was to try to get them much more rapidly into services. So the subcommittee has lots to discuss.
Thank you.
Thank you, Councilmember Burns. Thank you, Sarah and Demita. I wanted to give one last opportunity here for any of the agencies that are still on the call, or if anybody else just with a public comment. I did say I wanted to revisit that before we do adjourn the meeting. Give you that opportunity now. Okay, I'm not seeing any hands. Is there anything else from the committee itself? I want to make sure we get to anything that you had concerns or questions over. Okay, well then it sounds like Jessica, you will follow up with the new subcommittee that was created tonight and coordinate and contact their first meeting. And then we have a meeting in March, which we can potentially discuss some of the thoughts and discussions and findings from that subcommittee, as well as some of the other items that we covered tonight earlier in the meeting. There's nothing else then? We don't need to do a roll call for adjournment, do we? I can't remember if that's how we closed. We just say
If there's
goodbye.
no
Okay.
further
You don't need
business,
to do that.
you can close it out.
All right, well, have a good night, everybody, and all the residents who attended. Thank you very much, and we'll see you all again in March.
So long.
Thank you, everyone.
Bye.
Bye-bye.
Good night.